All right, very good. Well, team, good morning. First off, I want to thank everyone for joining us this morning. We're here to talk about a very popular topic. I'm sure it's a question that many of you have received. For us here at EBS, it's probably a topic of conversation we've been having on a very regular basis over the past year. It seems that whether it's the news, our community, social media, friends and family, many people are talking about weight loss medications that have absolutely blown up on the market. And so I'm very excited to be here with our esteemed colleagues, Phil Baker and Michelle Zullo over at Halo Scripts. Many of you may be familiar with both Phil and Michelle. They have very extensive backgrounds in the pharmacy management space. Both Phil and Michelle have been in the retail world of popular retail pharmacies that you'd see. They've also both worked in rehabilitational hospitals as director of pharmacy management programs. And most recently, they've created one of the first nonprofit membership-based pharmacies that works with uninsured or underinsured patients. And they took some of that same thought and that same value and brought it over to the employer space, which many of you may be familiar with Halo Scripts. And if you're not, we can certainly touch on that a little bit later on during our presentation. But as we dive into our presentation here, team, really our agenda is, real quick. Our agenda is going to be broken down into, sorry, team. Our screen's moving a little too much faster than my fingers are here. There's 4 categories that we're going to be talking about. One, the introduction to GLP-1s, exactly what they are, how they're broken down between medications designed to use for diabetes or for weight loss, the financial impact we're seeing on health plans for the coverage of those medications, and then ultimately what our recommendations are when it comes to containing cost and what you're able to do next in order to influence cost within your plan. And so with that, I will turn it over to Michelle to take our first part of our presentation.
Hey, good morning, everyone. So like Ben said, we are talking about GLP-1s. And so I'm going to just dive in a little bit to the clinical side of things and give everybody an overview of what they are, how they work, and how we are able to use them in the weight loss space. So their role has been found to be beneficial in weight loss, but this was actually initially This was initially, it was garnered actually as a side effect, because when they started using these medications to optimize people's glycemic control in diabetics, they quickly noticed that patients were losing weight. So then they started looking a little bit closer as to how does it really promote weight loss. And there's a lot of GLP-1 receptors throughout our bodies. And one of them is within the appetite, cascade, where it allows, once this is stimulated, it does allow your brain to send, a message out to your body to let you feel like or think that you're actually full. So reducing your appetite. It also is noted that it does slow down gastric emptying. It also slows down gastric emptying of the stomach, which also reduces how much people are consuming. Also improves body sensitivity to insulin, which is why it was initially actually marketed for diabetes control or helping with diabetes. Next slide, please. So when we look at GLP-1 agonists in diabetes, right, like I said, the primary goal was to improve glycemic control, and the weight loss was a beneficial side effect. When you think of a diabetic patient, one of the things that you're also thinking about is if they manage or lose weight, that correlates directly to their glycemic numbers. So this being a double-edged, medication, because not only was it helping control the glycemic control, but they were also losing weight. So it was a win-win. When we look at GLP-1s in weight loss, so the goal now is a little different, because now we're really just focusing on patients that are overweight or obese. And in most cases, we've noticed that they're having to use higher doses when it comes to the weight loss arm of things. It is important to note that the mechanism of action still remains the same. So it is mimicking the GLP-1. It's just the difference is the dosing. And in some cases, the patients don't necessarily have diabetes when you're looking at the weight loss group. Okay, so side effects. you've got to think about, once you start adding things, exogenous things into your body, it comes at a price, right? Some of the things that were noted as far as side effects are concerned, particularly in the weight management arm, is with gastrointestinal issues. So with the diabetic patients, they complained about these gastrointestinal issues, but it hasn't been as high as what's being reported now in the weight loss group, because we're using higher doses. So you would expect there to be a correlational when it comes to the side effects. Anywhere from constipation, biliary disease, bowel obstruction, gastroparesis was one of those are things that were noted within the gastro, side effects arm of things. And then as far as the tumor adverse events that are noted, so in the lab rats, they did find that a lot of them were having T or tumor C cell thyroid tumors, which then became cancerous. It hasn't been, I guess, really related to human beings yet, because it's too early to determine if that's the case or not. But the FDA really wanted that to be noted. So it's actually a black box warning for all of these medications that there is a potential for thyroid cancers related to it. We won't know until a little bit more time has gone by. Next slide, Ben.
Michelle, is that safe to assume that it's a wait and see kind of category? They've seen it happen in animal testing, but with much higher dosage on humans. They're not quite sure now with the titration how much of a possibility cancer could be.
Right. So they're not very sure, but for the FDA to put a black box warning, it's almost like in time, it's going to become one of those things that we do look at and say, hey, if you take this medication, you have X amount % chance of getting thyroid cancer, because we're using mega doses compared to what's being used in the diabetic arm of patients.
Yeah. And Michelle, outside of the risk of cancer, you talk a little bit more about the paralysis of stomach aspects, the cholecystitis, some of the other issues that people may necessarily kind of breeze over when you kind of hear everyone kind of thinks about nausea, diarrhea, constipation. Kind of describe that a little bit more detail as to what you've seen from a pharmacy perspective.
Right. So for the mega doses, constipation becomes something that you're now, I guess, polypharmacy, right? Because you're treating their weight loss, but you're also treating actively constipation, because the gastric emptying, the slowing of the gastric emptying, just like it sounds, right? You're slowing down how fast your body is getting rid of waste. So now you start to worry about constipation, which could lead to impaction. And impaction can be very dangerous because, our bodies were designed to get rid of waste.
Thank you, Michelle.
Yeah. And then so long-term considerations that I think people also haven't really thought about is Ozempic is going to be a lifelong therapy if we start using it for weight loss. And with that being said, it does reduce, initially, it reduces the amount of fat, like how big your fat cells are. So it shrinks those. But in shrinking them, it's multiplying how many fat cells you have. So the moment you stop taking Ozempic, you have what's now being coined as Ozempic rebound, where your fat cells could potentially expand, but now you have multiple fat cells. So you have a larger expansion. So they did say anywhere from 10 to 15 pound weight gain has been noted already for people that did stop taking Ozempic. And we still don't really have long-term use. We don't have data for the long-term use at these high doses. We've got a lot of research on the smaller doses that are being used in diabetes, but as far as the weight loss, there's still so much more that's being done. So they do have pharmacosurveillance that is going on, people having to report side effects that have happened. And then the one thing that I did find that was very, very interesting is pregnancy, right? So it's actually not indicated in pregnancy. They would tell you if you're planning on getting pregnant to not take Ozempic, but there's been a number of pregnancies reported And it kind of makes sense when you think of it from a clinical standpoint, because if you're overweight or if you have PCOS, so you have a insensitivity to insulin, right? Now you are more sensitive to insulin and your weight is going down. Women have been actually advised when taking Ozempic or these GLP-1s to be sure to have contraception, because pregnancy is something that I think has kind of flown under the radar. We're not talking about it much, but I think we really need to start pushing, talking about it as clinicians, that this is a big risk for childbearing age females. And I'm sure you guys have seen a number of articles that talk about Ozempic face, Ozempic butt. We don't really think about the effects that it has on us physiologically, but as we're losing weight, you're also losing your muscle mass and your connective tissue. So that then gives you the droopy face or the droopy butt, but also you're also losing your bone density. Amy Schumer was actually interviewed by Andy Cohen, and she said if she knew what she knew now, she would not have taken the weight loss drug that she took for a year because of the side effects. The side effects were just so much more horrendous than the weight loss that she got from it.
Awesome. Thanks, Michelle. So team, if you take a look at the drugs that are currently available on the market, you see a variety of different GLP-1s that have the formal scientific name, but most brands people have become familiar with. And the majority of these medications are taken in an injectable format that's self-administered. And the most glaring piece for most of these medications comes down to the cost. And depending on the type of insurance that you have, whether it's a fully insured, self-funded, or another form of arrangement there's varying degrees for how these medications are covered. Some people have opted to pay for them in cash. Some health plans have adopted the cost for specifically diabetes, but not for weight loss. But at any rate, taking a look at the cost of these medications and the prevalence of both diabetes or obesity within a population certainly leads to a potential for significant cost for the payers of these expenses, specifically either employers, employees, or health insurance companies. And so if you look at the overall impact on a health plan perspective, most health insurance carriers are talking about this. Again, anyone who's been a payer of these expenses, this has been top of mind for them because of the explosive growth of these medications. The most popular manufacturer of these medications for both Wegovy and Ozempic is a company called Novo Nordisk. If you were to look at their share price over the past few years, it's absolutely skyrocketed. This medication or these types of medications are taking up so much attention and they've had so much adoption that other aspects of obesity or weight management have taken a significant decrease, meaning other tools and resources or even surgeries. For example, the rate of bariatric surgery has decreased significantly because of the rise in popularity. You even see some of the causation effects of obesity, specifically stocks like Walmart, Target, other big box stores, taking a hit specifically because of the amount of medication that's being consumed as a means to slow down appetite, where these other costs and these products are not being consumed. If you look at where the market is heading, it's going to continue to increase in a significant way. More companies are introducing weight loss medications. Eli Lilly's Mounjaro is exploding in growth and popularity. Their stock price is also growing. And because of the attraction to these medications, many pharmaceutical manufacturers are looking at these medications in their pipeline and pushing them closer and closer towards FDA approval. And so this is a problem that's not going away. If anything, it will continue to get worse. And specifically in the case of cost, we see this as a major challenge for the payers of these expenses. Again, health insurance companies, employers, and employees. If you were to take a look at an example of how these medications from a weight loss perspective are able to impact a company, it really boils down to whether a company, in this case, let's take the example of a self-funded organization, chooses to cover GLP-1s for weight loss purposes. And again, taking a step back, we know GLP-1s can be used for both diabetics and weight losses. The major difference is just the dosage of them. Again, for weight loss, it's much higher dosage. for the GLP-1s than it is for the diabetes side of things. And so with some of the analysis that we performed on behalf of our self-funded companies, we know that if a 250 person company chooses to cover GLP-1s for weight loss, even with a lifetime maximum of 18,000, you can expect to see a total claims expense increase of 5%, meaning just covering these weight loss medications, your total all-in increase just for that medication alone, for the coverage of that, in addition to everything else, represents 5%. If you put no restrictions and simply cover the GLP-1s outright for weight loss, you can see a 10% increase. And if you look at the total amount of dollars that correlates to, team, it is drastic. You're talking about hundreds of thousands of dollars to millions of dollars for simply covering these medications. We see now that some health plans that originally covered them, some notable large health plans, for example, the state of North Carolina, originally came out and decided to cover weight loss medications because they thought that the risk of cardiovascular disease was a greater expense than the cost of obesity and the reduction of it. We can see now many health plans are actually now removing these medications for weight loss when they originally put them on a year or two ago, because they can see their health plan budgets blowing up in a significant way. That leads me to my next point, team. You often hear that these weight loss medications, through a reduction of obesity, you can see a correlation, the reduction of cardiovascular disease, which is a very, very expensive disease to treat that most health plans see a risk of, right? Things like stroke, heart attack. And what we understand, though, is that if you look at the cost of obesity and the prevalence among the population, where these medications are priced today, there is not enough cost effectiveness to make it make sense. And I'm going to break that down a little bit greater. What we know is that a person today at risk of cardiovascular disease versus a person who has cardiovascular disease that's obese that takes the medication, there's not much of a difference between the increase, healthiness, or the reduction of cardiovascular disease from the cost comparison between not taking the medication or taking the medication. So at the end of the day, there was a very, very popular study that was released from the Institute of Clinical and Economic Review that showed in order for these medications to be priced effectively, so the risk of cardiovascular disease, the reduction of that was better than the cost of these medications, these meds would need to be priced somewhere annually between $7,500 to $9,800. And currently, they're anywhere between $12,000 to $18,000 annually. And again, if any of us understand how prescription trend works, we certainly know that these medications are going to get more expensive, not less expensive. And so some of the arguments that are made that the risk and the reduction of cardiovascular disease is the reason to cover these medications. Well, from a financial perspective, there's been independent studies that say otherwise. So, Phil, I will turn it over to you.
Thanks, Ben. So where do you go from here? So what we've said so far about these GLP-1s is that they're drugs that are really quite good for diabetes. However, when used for weight loss, they are used in much higher doses. Those higher doses create increased side effects, and the cost effectiveness of the drug at the end of the day has been proven not to be there. So for our clients and the folks we advise, we recommend not including them for weight loss. Don't cover them for weight loss on your plan. However, if you have to cover them for whatever reason, then you need a good prior authorization in place to manage their utilization. The prior authorization needs to require that the patient have a BMI greater than 27 with a comorbidity, or greater than 30 overall. You should mandate that the patient be in a weight loss management program, and you should cap the annual spend for this family of drugs, so that giving the member the understanding that we support their journey towards weight loss, and we hope that this will be a kickstart for them to have lifestyle changes that maintain that weight loss. The cap is intended to end after more than a year, and so that would be well enough time to decide if that's going to if this drug is going to cause that effect for them. The next slide. Okay, so how can we help? Well, this is where HaloScripts comes in. We can take a look at, and we do this every quarter for each one of our clients, take a look at their claims for the quarter, identify the patients that are currently on these medications, engage with them to transition them to the most cost-effective option on the plan, and then continue to monitor that on an ongoing basis.
So team, at the end of the day, what we understand is that these medications are already on health plans from a diabetic perspective. We understand that in the case that you want to cover weight loss medications for the GLP-1s, there are many ways to obtain those medications at much lower costs. And how you're able to do that is working through a pharmacy management program like HaloScripts to be able to do that. They interface directly with the patient. They interface directly with the prescribing provider. They ultimately understand how to best serve that patient with lower cost needs. So everybody wins. Member gets the medication they're looking for. Health plan's able to support those goals from a diabetic or weight loss perspective, but do it in the most cost-effective manner, which is something that without the help or guidance of a pharmacy management program like HaloScripts, ultimately you see some of the exploding costs that you see earlier in our presentation here. And so team, that's the end of our presentation here. We do have our next presentation coming. That's going to be a focus on medication adherence, often a problem most people aren't familiar with, but one of the largest problems in healthcare. It's one of the top leading causes of hospitalizations. Most people don't understand how bad prescription adherence is amongst patients. And so if you want to join us for that webinar, we encourage you to do so. Again, Wednesday, December 6th, 11 a.m. It'll be a short and sweet, just like this one here. Any more information about our webinars, you can find us on LinkedIn if you want to follow our pages at Employee Benefit Services of Maryland, Inc. or HaloScripts. And with that, team, we can certainly take any questions anyone might have, whether you want to throw that in the chat or come off mute. We're certainly able to address anything that you may have in the last remaining 5-6 minutes or so. Any questions for anybody?
Hey, Ben, it's Dawn Alms. How are you?
Hey, Dawn, doing well.
Good. I wanted to ask about, I'm no longer with Care First. I left about 4 months ago. But what about a nutrition and fitness component? If employers are going to cover this, requiring their employees to do, some more holistic approaches, because as we know, when they go off, they're going to gain the weight back. So changing lifestyle, is there discussions about that? I know I saw educational weight loss programs, but that can mean a lot of things. So I wanted to find out more about what is that, what's incorporated in that.
Yeah, you're exactly right. It is employer by employer, and it can be something that the employer sponsors from a weight loss perspective so they can accurately see a member participating with it. Or we've seen some plans say it's up to the member. For example, if they wanted to go through their own Weight Watchers program or something similar of nature, they could. It really comes down to how involved the employer wants to get into managing the education of that patient and the budget that they have that they can allocate towards that education. Some of our employers already have a type of nutrition wellness component built in that they can leverage. Some of our employers are looking at programs to adopt, to bring in, to help support this initiative. But I completely agree, Dawn. The lack of those would certainly lead to the risk that we all kind of see here. Once you stop the use of these GLP-1s, the weight will rebound very quickly. And as Michelle pointed out, you're actually in a worse position on the rebound of weight because of the multiplication of your fat cells because of what that GLP-1 does to the body.
Yeah, it's definitely very risky. And
Sure.
I am seeing, I hear women talking about taking it when they only need to lose maybe 20 pounds. They're not even, they really don't have a large weight loss need, and they just don't understand the situation they're putting themselves in.
Dawn, you said it perfectly. Thank you.
Mm-hmm.
Good to hear from you, by the way.
You too.
Team, any other questions? Bill, Michelle, anything you'd like to add from your side as we kind of close things out? We can certainly wait for a few more questions to come in, but anything else that you'd like to add from a pharmacy side of things?
No, we just want to say thank you to everybody for coming out and hearing our webinar.
Cool. All right, team. Well, you certainly know how to reach us. You can reach out to your EBS team. If you want to reach out to Halo Scripts, we're more than happy to address any additional questions. We hope you found this to be valuable, and appreciate you carving out time to come in and talk with us today. Thank you, Michelle. Thank you, Phil.
All right,
Thanks,
thank you.
guys.
Take care.
Thanks,
Bye.
everybody.
Thanks. Bye.